to Mrs. Racquel Kaufler. She is one of our patients, a very special patient. She's also an advocate and an activist for cancer research and for kidney cancer. So she has been with us for several years. Racquel.
Thank you, Dr. Machado. Thank you, Ana Paula. Thank you all for being here, all the doctors, your participation, your collaboration, and thank you, patients and caregivers, for being here. I have been fighting cancer for the past 8 years, and it seems like I never stopped learning about this disease. My story is not, it's very unique, just like I'm sure that all of your stories are. I was traveling in December of 2011 with my husband. We were flying back from Israel to Miami, and it was about 3 o'clock in the morning, and our flight was at 8 o'clock in the morning to fly back to Miami. We're sitting at the lounge, and all of a sudden, my husband was falling asleep. He was actually asleep, and I had to go to the restroom. So I go to the restroom, and I had to urinate, and all I saw was blood coming out. So I was told later on that it was gross hematuria. I was very scared because I did not know what that was. All of a sudden, just blood gushing out of my body. As soon as I came back home, it was the end of December, I saw my primary doctor, and he said, "You probably have an infection," and gave me some antibiotics. I took the antibiotics, but the blood did not go away. So I went back to him, and I said, "There's something wrong because I still have the blood. I don't have any infection. I feel fine. I have blood." So I insisted him to give me a prescription for an MRI. Long story short, I had the MRI, and he called me in one day and said, "You need to come in because I need to see you." Basically, he told me that I had a big mass in my kidney, and he sent me to a urologist. So I went to the urologist, and he sent me for another MRI, and he confirmed to me that I had cancer, but not just cancer, it was stage 4 kidney cancer, clear cell, and I had gone outside. It was not encapsulated, but it had traveled to the vena cava, and it was going to be a very complicated surgery. And he said to me, that we had to have surgery, that they had to take the kidney out because it was a very large mass. From what he gathered, it was a slow-growing tumor that it had been in my body for the past 13 years. So I was a 44-year-old female. I led a very healthy lifestyle for the past 10 years prior to getting diagnosed. I was running 3-4 marathons a year, doing triathlons, really putting my body through a lot of physical stress. So for me to realize that I had this huge mass in my body, I never felt any sort of pain. I had no symptoms. I really put my body through a lot of physical stress. Never did I collapse running or training or anything. I did not feel any pain whatsoever, none whatsoever. So to me, it was a shock that all of a sudden I had this huge mass, and my life had just, from one minute to the next, it changed completely. Going back prior to 2011, I had taken my mom. I lost her in 2 years. She was 83 years old. She had sarcoma. It was a very aggressive sarcoma. And I took care of her. I used to take her to Sylvester for radiation every morning. At 7:15, we would be here. She had 9 surgeries. It was very complicated. I was her caretaker. I was by her side. And I got so much involved in her cancer. I would read, I would do research. I knew all the doctors. I would just deal with all of them. And when she passed away, it was very traumatizing for me. A year later, after she passed away, I was diagnosed with cancer. So when I got those news, I said to myself, I knew that I was going to get cancer because you study it so much, you read about it so much that you think that those things are going to happen to you. So it was time for my husband to be my caretaker. And I knew what role he had to undertake to take care of me. But I decided not to show any fear, not to show any pain, and just to fight. Because that's just my way of treating life and facing life. I just very positive, very, very, very positive. Even when I was running marathons and I would be in pain and I would lose my toenails and and I just had this spirit of always keep on going and not suppress every pain. Just forget about it and then just think that every step that you took, you would be closer to crossing that finish line. So going back to having this diagnosis, my urologist said to me that, thank you, Anna, that as he said that it was a very complicated surgery because it had gone through the vena cava. And he said to us, as long as my mentor is alive, he is going to do this surgery because it was a very complicated surgery. This mentor of his is Dr. Gaetano Ciancio. He is the director of the kidney and liver transplant at Jackson. He performed surgery on me in January 23rd of 2012. He took this huge tumor out, about this big. It had gone through the vena cava. He had to do a special procedure, heart bypass. In other words, he had to cut circulation to the heart because the cancer was going through the vena cava, which it goes to the heart. This was a very, very extensive surgery, but I came out of it fine. I went home, I recovered. I felt great, and after he told me that I had to, because I had cancer, then I had to follow up with an oncologist here at Sylvester. So I came to Sylvester, and I was under the care of one of the oncologists, who I happened to know because he had helped my mom when she was diagnosed. So I would come to Sylvester and get my exams, my regular scans. And 13 months after the surgery, so that was in July of 2013, the doctor tells me that the cancer had metastasized to the lungs. So I had about 6 tumors, and I have 3 or 3 on each lobe. So at that time, this is 2013, the oncologist that was taking care of me gave me not too many options for treatment. He mentioned that the treatment that he highly suggested was interleukin-2, which is a very aggressive treatment with only a 5% chance of survival. Given those news, I decided to seek help elsewhere. I did research. My husband and I kept going on the internet, looking at other alternatives for treatment because I wasn't ready to be under those treatments that was very toxic and only 5% chance of survival. So long story short, we ended up with a friend that recommended us to look into Memorial Sloan Kettering in New York. That was in 2013. I ended up with Sloan Kettering, and I met my doctor, that one of my oncologists now, because I am very fortunate that I am under the care of Dr. Marchand, and it's going great. So I have two great doctors, one in New York, one here. And my first treatment was Votrient. It was one of the so-called target therapy. Yeah. Funny, you asked, you were concerned about the side effects. Well, 90% of the side effects that you saw here, rash, hand-foot syndrome, hypertension, diarrhea, thyroid, all of that I had. I mean, I was super healthy. I didn't have to take any pills for anything. I never had any surgery in my life, and all of a sudden I had stage 4 cancer, and I was under all these different types of medication. The first treatment, it was Votrient, and it sent me to the hospital. I remember 10 days into it, I sent Dr. Marchand pictures of, I looked like that lady with the rash. Then they discontinued that treatment, and in January of 2014, I started Sutent, and I was on Sutent for about 4.5 years. And both of my doctors decided that it was best for me to go into immunotherapy. So I've been in immunotherapy now I started in September of 2017. Now, I remember that when I first started nivolumab, it was Opdivo. With every treatment, there's different types of side effects. And one of the side effects of Opdivo is swelling. So everything swells. In the joints, the doctors told me that the first scan after your first 3 months of treatment, not to be scared, because usually the tumors that you have are going to look like they're going to appear much bigger than they are, but that's because of the swelling factor of the medicine. So it was a miracle, because the first scan that I had, it was in December of 2017, only 3 months after the treatment. My tumors are reduced by 30%. During those 3 months, the first month of treatment, I remember calling Anna and saying, Anna, I feel like somebody hit me with a baseball bat. I cannot walk. My knees hurt, my elbows hurt, my back hurts, and everything in my body hurts. And as a line of the protocol of trying to rule out things that might happen to you, which is probably, you have knee problems, you have arthritis, you need to go see a arthritis doctor. And I said, this is not from arthritis, because I never had pains in my knees all those years running, all those miles. I know that I don't have arthritis. It was just the side effect of the treatment. So, I mean, yet another side effect to endure. And I remember she telling me, she goes, we could stop this treatment. You can stop. It's quality of life versus length of life. Of life. And I said, no, I want to endure. I want to keep with the treatment, even if it hurts. I have been told that for the first 3 months, you're not gonna see the actual, the benefit, because it's probably all the tumors are gonna be swollen. Then that means that I have to wait another 3 months after that, so it's 6 months. So I'm looking at 9 months until I start feeling really, or seeing good results. And I said, oh my God, 9 more months of pain. But what did I tell you, Adam? Dr. Marshan, I said, no, I don't care about the pain. I am just going to keep on doing it, because if I stop the treatment, then we'll never know if it works or not. So, I mean, I started with like 6 tumors, and it went to 9 tumors and 16 tumors in both of my lungs. And in the first 3 months of Devo, they had reduced by 30%. And then after that, by 50%. And in the middle, by 2019, last year, beginning of 19, there was no trace of tumors in my lungs. So it's incredible that there's treatment out there, there's medicine that can cure, or that can allow us kidney cancer survivors to keep leading a healthy life. I don't want to undermine the people that are going through a lot of pain and suffering. We are all different. Our cancers are all different, unique to each one of us. But I just think that the desire of each one of us that suffer from cancer is so gigantic, and desire to live, desire to feel like everybody else, desire to have a normal life. It's so much greater than anybody that doesn't have any disease. And because I have cancer, I live a better life. I appreciate things better than somebody that complains about having a headache, or that they stubbed their toe, or they crashed their car, or just little things like that. I mean, we're like battling cancer. We have pain. We have, hand-foot syndrome. Sometimes we just, we ache. But I speak from experience. I don't feel pain. I really don't. And it's just, I'm very incredibly lucky to have a great support system at home. My husband, my loving husband, and my doctors, Dr. Marshan, Dr. Motor in New York. And I thank all of you that are here, that share your story, that are with me in this fight. And all I can say to you is just keep living, be happy, just smile, don't mind the little things, and just be thankful that we're here and we're alive. Thank you.